Hello, my name is Trina Anderson. This is my informative speech assignment. I'm going to be informing you on pyromania and diagnosing. On February 24th, 2016 at 9:58 Eastern Standard Time, pyromaniac David Daniel Brown, 27, has been jailed for 5 years for torching a chapel used as a mortuary. Brown was jailed after admitting he got a kick out of arson. The DSM, which is the Diagnostic and Statistical Manual of Mental Disorders, classifies pyromania as a disorder of impulse control, meaning that a person diagnosed with pyromania fails to resist the impulsive desire to set fires, as opposed to the organized planning of an arsonist or a terrorist. Some American researchers would prefer to categorize pyromania and the other disorders of impulsivity as part of the obsessive compulsive spectrum. Pyromania is considered a relatively rare impulse control disorder in the adult population in America. Most younger fire setters are diagnosed as having a conduct disorder rather than pyromania. This age group speaks of fire setting rather than using the term pyromania itself. Pyromania is divided into 5 categories: fire setting as a cry for help, delinquent fire setters, severely disturbed fire setters, cognitively impaired fire setters, social cultural fire setters. Pyromania in adults resembles the other disorders of impulse control, and they have a high rate of comorbidity along with the other disorders, which include substance abuse disorders, obsessive compulsive disorders, which is OCD, anxiety disorders, and mood disorders. One study of 17 teenage fire setters, 14 male and 3 female, found 6 different self-reporting reasons for fire setting: revenge, crime, they try to hide the crime by setting fires, peer group pressure, accidental fire setting, the denial or the intention of the fire setting, and fascination with fire. Lack of fire safety skills or ignorance of the dangers associated with fire setting. There are more male than females diagnosed. Repeated fire setting appears to be more common in children and adolescents than in adults. Less is known about the incidence of pyromania among adults. Some researchers think that children and adolescents attracted to fire setting when they are younger, they graduate into adults with more serious crimes with like a macho image, including serial rape and murder. The EEOC, the Equal Employment Opportunity Commission, they exclude pyromania, along with kleptomania, compulsive gambling, disorders of sexual behavior, and the use of illegal drugs, from the list of psychiatric conditions for which employers are expected to make reasonable accommodation. The EEOC's exclusion of pyromania indicates that workers with this disorder are considered a sufficient direct threat to other people and property that employers are allowed to screen them out during their hiring process. On the DMV, it requires 6 criteria that has to be met for a patient to be diagnosed with pyromania. The patient must have set fires deliberately and purposely on more than one occasion. They must have experienced feelings of tension or emotional arousal before setting the fires. The patient must indicate that he or she is fascinated with, attracted to, or curious about fires and situations surrounding the fires. The patient must experience relief, pleasure, or satisfaction from setting the fire or from witnessing or participating in the aftermath. Patients cannot have any other motives for setting the fires, such as financial motives, ideological convictions, anger or revenge, a desire to cover up another crime, delusions or hallucinations, or impaired judgment resulting from substance abuse, dementia, mental retardation, or traumatic damage. They cannot be accounted. It cannot be accounted for antisocial behavior disorder or conduct disorder or a manic episode. The symptoms. Sigmund Freud had hypothesized that the fire setting represented a regression to a primitive desire to demonstrate power over nature. The cause of fire setting among children and teenagers are complex and not well understood. There's individual and environmental reasons that they've come up with. The individual or antisocial behaviors and attitudes, sensation seeking, attention seeking, lack of social skills, and lack of fire safety skills. The environmental ones are poor supervisions on the part of the parent or the other adults that are in their care. Early learning experience of watching adults use fire carelessly and inappropriately. Parental neglect or emotional uninvolvement. And the psychopathology of the parents. Fire setters are significantly more likely to have been physically or sexually abused than children of similar economic or geographical backgrounds. They are also more likely to have witnessed their parents abusing drugs or acting violently. Peer pressure and stressful life events. Diagnosis of pyromania is complicated, and there's just too many factors. One important factor is the adequacy of the diagnostic category itself. Some psychiatrists are not convinced that the impulse control disorder should be identified as a separate group. Um, Another complication is in diagnosing is the lack of experience on the part of the mental health professional in dealing with fire setting. And a lot of cases they're just not unaware that the patient is repeatedly setting fires, or they regard the pattern as a part of cluster or antisocial dysfunctional behaviors. But as far as the DMV, the diagnosis, they must have set the fires deliberately and purposely. They must have experienced feelings of tension or emotional arousal before setting the fires. Must indicate that they are fascinated with, attracted to, or curious about fire and situations around the fire. They have to experience relief or pleasure from setting the fire or from witnessing the others do it. Cannot have motives for setting fires, and they can't have any other antisocial behaviors or conduct disorders. The treatments for children and adolescents, that's more effective if it follows a case management approach rather than the medical. They follow them, the individual adolescents and children for that are suspected of having the diagnosis. They keep track of them, and just periodically through they monitor how they are reacting to their environment and their surroundings. As far as adults that have been associated with the symptoms, the pyromania in adults has been associated with symptoms that include depressed moods, thoughts of suicide, repeated conflicts in interpersonal relationships, and poor ability to cope with stress. So their treatment is problem-resolving skills, anger management, communication skills, aggression replacement training, and cognitive reconstructions for the ones that they can. The adults in pyromania are considered difficult to treat because of a lack of insight and cooperation on the part of most patients, because they don't follow up, they don't come themselves, they're adults, they don't have to do what they don't want to do. The prognosis for recovery for fire setting among children and adolescents depends on a mix of individual and environmental factors. And the diagnosis for adults with pyromania is generally poor. They don't see very good outcomes for most of them. So in conclusion, pyromania is not an easily diagnosed by professionals. There are many variables that contribute to and exclude from the process of diagnosing someone.